I'm sure we all know about high blood pressure, whether we know it in detail or just have an idea of what it is. There is medication that will be prescribed to control high blood pressure, which can be dangerous to our well being. So, my next question is once we start high blood pressure medication, can we at some time in the future stop taking the medication? I'm sure that question must have crossed the minds of those who have started taking medication for high blood pressure. After all, nobody wants to be taking a medication for ever and ever if there is a way to be off it medication. Now, regular and sustained exercise, which hopefully will lead to substantial loss in weight, eating healthy diet, and to quit smoking. If we are regular smokers, can help you control high blood pressure, which is often as hypertension, and it is to improve your overall health. Some people find that after making these lifestyle changes, they no longer need medication to control their blood pressure. However, before you stop taking blood pressure medication, you'll need to work with your doctor to assess the risks and benefits. So, the question, can I stop my hypertension medication? To make an informed choice about your need for ongoing treatment, you and your doctor will first need to review the cause or the causes of your high blood pressure. The reason being the cause needs to be ascertained to determine if it may be affected by a stop in taking the medication. What are the various causes of high blood pressure? Well, they can be like being overweight or obese, or in other words, excessive weight, chronic kidney disease, diabetes, smoking, stress, whether work related or otherwise, excessive alcohol intake, high consumption of alcohol on regular basis, family history of high blood pressure, lack of exercise. Now, age playing a factor, which means as you grow older, you are to expect that you will likely get high blood pressure the higher up the age you grow. Disturbance in sleep patterns, thyroid disorders, and cancer. Inclusion of too much salt in the diet. You could actually divide high blood pressure into two different groups. One that you can change and manage, and one which you cannot, or rather which is fixed. The first is those you can make change to, for example, your diet or your activity level. Others like genetics and age are not factors you can control, as you cannot change your genetics or your age. Now, in 90 to 95% of cases, the exact cause of hypertension is never nailed down. This type of high blood pressure is called essential hypertension. If your doctor determines that your high blood pressure is primarily related to modifiable factors and your blood pressure readings normalize after you make changes, it may be time to discuss whether you need to continue taking medication. So there is hope, but of course, you need to consult with your doctor who knows your history to determine this point. There is no fixed time duration before patients need to have normal blood pressure after making lifestyle changes before stopping meds. But several studies do suggest a waiting time between 6 months to 2 years, just to be on the safe side. The decision is not cast in stone and depends on the body's behavior, and each person's needs must be assessed by each individual. However, if you have lost weight, sustained a healthy diet and exercise program, and quit smoking, your doctor may decide to have you try a trial period without medication. It is all dependent on your body's reaction. If you stop taking medication and your blood pressure goes up again, you can always resume treatment, along with continuing the lifestyle that changes that you have made. When should you not stop taking medication? If your high blood pressure is due to non-modifiable factors like a family history or variable ones such as chronic disease, you may not be able to stop taking your medication. Particularly true for older adults as age is an independent risk factor for hypertension and tends to be associated with greater complexities in managing chronic illness. Now, making informed decisions. Keeping yourself healthy and living a healthy lifestyle is more than avoiding medications. It's also about improving the quality and the length of your life. Even if you have made a lifestyle changes, your doctor may not want you to stop treating your high blood pressure with medication. Do engage and understand their reasons and try not to get discouraged, as it will be for your own good in the long term. The doctor's recommendation doesn't necessarily mean you are in poor health. In your case, your doctor has decided that the benefits of continuing treatment outweigh the potential consequences of stopping, so he is taking an overall view on that decision. So basically, he takes an overall view of your health, your history, and your genetics before he decides. While you might prefer to avoid pharmaceutical treatment, know that there's nothing bad about taking medication to treat high blood pressure. Antihypertensive medications are not addictive, and the side effects are generally manageable. However, there are different kinds of blood pressure medications. Now, research has shown that the type that works for about one person with high blood pressure may not be the best choice for someone else. So your doctor can help you decide which antihypertensive medication will be the safest and most effective for you. Now, even if your changes in lifestyle seem to have improved your blood pressure, never stop taking your medication without talking to your doctor. It is very important, as we do not wish certain factors to affect your health in the long term. Now, if you really feel that you don't agree with the doctor's advice to continue taking your blood pressure medication, always seek a second opinion and be sure before you decide. You have the right to make decisions about your health. Just make sure your choices are informed, because we will not wish you to regret your decision at a later point of time.